Last time I had the flu, I was miserable. I felt like I had been hit by a Mack truck. I was very sick.
Influenza is a contagious respiratory disease that can lead to serious complications.
Most people trivialize influenza in our population today. They think it's a benign illness, but it really isn't. There are over 36,000 deaths in the United States annually from influenza, 250,000 hospitalizations, and even normal people who are otherwise healthy are oftentimes bedridden at home and are not able to work for several days.
Dr. Whitley is the Loeb Eminent Scholar in Pediatrics and Vice Chairman of the Department of Pediatrics at the University of Alabama at Birmingham. He is a leading expert in the prevention and treatment of viral diseases.
The most important thing in thinking about influenza is to get immunized every year, particularly if you're at high risk. Young children, elderly adults, immunocompromised patients, pregnant women. Influenza vaccination is key to prevention of disease. The Centers for Disease Control has a wonderful website that will teach you when to get immunized and how to get immunized. But remember, get immunized in the fall, and even if you're not immunized in January, get immunized.
This is especially important for healthcare providers who work with patients at high risk of complication from the flu, like Melissa Wallace, who was a nurse coordinator in a bone marrow transplant unit.
Flu season is from October to April of every year, and we require that anyone who would provide direct care for any of our patients have a flu shot before the end of October of that year.
It is strongly advised to get one because of working around the sick babies that we do. I do get a flu shot every year, and they try to stress for everyone else to get one as also.
People get influenza in spite of being immunized because there can be slight shifts in the vaccine each year. More importantly, some people don't want to get immunized. Personal hygiene is essential in preventing transmission of this infection.
Symptoms of the flu include fever, headache, dry cough, muscle aches, sore throat, and to a much lower extent, a runny or stuffy nose.
Influenza is mainly a clinical diagnosis. Patients have weakness of their muscles, they're tired, they have fever, and they have a cough. We do have rapid diagnostics. They're better in children than they are in adults, and we can use them in physicians' offices. But for the most part, it's a clinical diagnosis.
I was very tired, and I had a lot of nasal congestion and headaches.
If an individual develops influenza, whether they were immunized or not, they should seek physician's care to receive one of the 2 licensed neuraminidase inhibitors. They should get treated within 48 hours after the onset of disease.
I went to the doctor, and he prescribed an antiviral for me, and I took that, and I think that did help as far as decrease the amount of sick time that I had, so I would definitely do that again.
Neuraminidase inhibitors are antiviral medications that are effective in reducing the duration of flu symptoms for patients who start therapy early in the disease course.
We have 2 licensed neuraminidase inhibitors that are absolutely excellent drugs. They should be administered within 48 hours after the onset of disease and require a prescription from your physician. Importantly, they can be used both for treatment as well as post-exposure prophylaxis.
If you are diagnosed with the flu, taking an antiviral medication may be a good option.
But receiving a prescription for influenza requires consultation with your healthcare provider.
Neuraminidase inhibitors are also recommended by the CDC to prevent the flu for people who have been exposed to it.
The neuraminidase inhibitors can also be used for what we call post-exposure prophylaxis. That means if someone in the family develops influenza, we should treat the other family members as well to prevent them from becoming ill. Particularly important populations for post-exposure prophylaxis are families where there's an elderly adult, or even more importantly, group care living situations.
If someone in my family had it, we would go to our primary care physician immediately to see about preventing the spread.
I would take an antiviral so that way I could get better quicker and be able to get back to work and be around the babies, and just because you don't want to feel that yucky that you feel when you have the flu.
For more information about treating and preventing the flu, visit this website.